Welcome to the January 2025 CTIPP CAN call. We're so thrilled to be with all of you and just want to say Happy New Year. And we hope that 2025 has gotten off to a good start for all of you so far. For those of you who were on calls with us over the last 5 years / especially the last 4 months, if you've been on any CTIPP CAN calls with us since really the pandemic hit, this call is going to be different than a lot of those, where a lot of those were more pedagogical webinar based. And now we want to create more of an opportunity for networking to take place. Most of our work at the end of last year for CTIPP CAN calls was around building trauma-informed advocacy and plans for each of us to move forward on our own plans for trauma-informed advocacy. To respect the work that all of you have done around that, we want to really move forward in, sorry, when a note taker comes in, sometimes it pops up with an additional note. There is, we want to make space for you all to connect. Was anybody on any of the CTIPP CAN calls in this room, what I'll call the OG CTIPP CAN, pre-pandemic, where Dan Press used to give like a federal policy update, and then people used to just get to talk and share what they were working on? That would have, the calls were like a dozen folks for the most part, and a lot smaller, but that's more of what we're going to try here, right? For folks who feel like just listening in, this is a really wonderful opportunity to hear about how other people are sharing and moving forward on trauma-informed advocacy, which is really, really powerful. But we want to try to venture back into that original sort of format where I'm still going to speak, I'm still going to provide an update with some different opportunities that CTIPP is moving forward on, but we really want to provide more of an opportunity for you all to share with each other and to strengthen the network, the community advocacy network, which is what CAN and CTIPP CAN stands for, to really strengthen that network and to provide the support that is necessary to continue to move forward in the work that we're doing, really holding space instead of just me talking for the better part of an hour and a half call with all of you, right? And so we are very, very open to feedback on how we can make these calls as good as possible, but we are so excited to be getting started this year with all of you and the advocacy that I know so many of you are taking on, both in terms of legislative advocacy and at like a local level and a community and organizational level to promote trauma-informed policies and practices. I mentioned Dan, and so much of our work is guided by the vision that he left for us that is encompassed within our Press On vision. And while I can imagine that he would be struggling with a lot of the trends that we see at a political level through the campaigns into the new year, I also know that he would be so heartened to know how many advocates are moving forward trauma-informed advocacy across this country, around the world, in so many ways. And that's what we're all here to do, to continue to build the movement to prevent trauma and foster resilience. I'm going to go ahead and share this screen first. Before I do, one other thing, that's what the first slide looks like. Before we get to that, I just want to mention 2 webinars very quickly, in addition to the CTIPP CAN calls that are going on. So one, I think Laura is going to be putting in the chat a link to a webinar that is taking place tomorrow around promoting transformational resilience coordinating networks. That is our work that we continue to do to build population level resilience to the impacts of climate related disasters. Already this year, we know the fires that are taking place in Los Angeles, and our hearts go out to everybody who is impacted there. the deep freeze that is hitting the areas of North Carolina and Tennessee that were impacted by Hurricane Helene, where some people still remain unhoused or perhaps without the infrastructure to be able to be comfortable through the deep freeze that is irregular, these extreme weather events that continue to occur, trying to build more of a public health approach to our approach around how we respond, how we promote community resilience to such destructive events. There's a webinar tomorrow that's free. I think Laura is going to be posting that link in the chat here soon. It was also in our newsletter, and then you'll hear tomorrow that there are more opportunities to move forward on that if you're interested. And the other webinar that took place on Friday that I believe our friend Bill Barberg is going to put in the chat is around neuronurturing. And there is a webinar series that is moving forward around the importance of the first 60 days, the first 3 years, how supporting and promoting positive and healthy and happy childhoods helps create life course trajectories throughout throughout multiple generations that promote well-being for individuals, for families, for communities, and ultimately for our society as a whole. And so wanted to note those two different options. Both are free, and we wanted to make sure to give light for both of those. Now I will get back to the slides to go through what we at CTIPP are working on to try to support all of you moving forward. We mentioned this quickly last year in the December call, our last CTIPP CAN call. But one of the offerings that CTIPP feels is really, really important to be able to provide for each of you as what we hope to continue to grow into an intermediary role for the trauma-informed movement is providing advocacy software for you all to create your own advocacy campaigns to promote legislation at the local, state, and or federal levels. And so this is a tool that would be, it's very expensive. We'll get to that at the end of this, but we want for it to be able to reduce the barriers to entry to create advocacy campaigns that you all can send links for people to take targeted actions in line with your advocacy asks that you don't have to pay us for. It is helping to promote the trauma-informed movement, which is what we want to do. And so we will, in the first couple calls, be talking a little bit more about how to take action and how this can support you. And we will continue to grow together, but think that this can be a really important insight and tool for folks who are doing trauma-informed advocacy work to take advantage of to promote trauma-informed policies at all levels. And so, again, we are working to co-create these sort of outreach campaigns with you. Laura, my wonderful colleague on the call, will be supporting your ability to do targeted outreach or sign-on letters or social media to legislators at city council, at the state level, at the federal level. The biggest thing is that we won't just accept any and all legislation. We want to make sure that it is aligned with trauma and with our values, with the trauma-informed model, both in terms of what the policies say, and like we worked on so much together last year in the last 4 months of that advocacy series, we want to make sure that the methods that are being taken to promote the advocacy or the policies themselves are also trauma-informed. And so there is a form that you all can fill out that you'll find on this QR code or that bit.ly link that I am assuming Laura is putting in the chat right now as well, where you can simply answer these questions, right? To let us know what the legislation is, to answer kind of how we're going about trauma-informed advocacy and how this legislation supports trauma-informed principles, and to understand your elevator pitch. Again, the things that we went through during that last 4-month series that will allow for you to be able to use this form. This is the first step. And then we'll take some time to get back to all of you, and then we'll co-create the campaign together. We'll make sure that you have decision-making authority, and we want to model the model. We want to make sure that we are co-creating this while also ensuring that it is aligned with just our organization's values. And then we can launch the campaign, and you can share that out with your network so other people can take action and conduct outreach in easier ways. It really reduces barriers to entry for folks to get involved. We know how daunting advocacy can be. And so this is just an example of what the Action Center itself will look like. The Community Mental Wellness and Resilience Act, which I'll touch on a little bit more in a bit, and the Rise from Trauma Act, those are just examples right now because they have not yet been introduced in this new Congress. But we will update those with the CMWRA, the Rise from Trauma Act, and you will see other bills that folks are working on in campaigns get in there as well. And then I think this is not, so this is what it looks like to support legislation on this slide. And it's just a very easy screen where you go in as an advocate, share some information about yourself. You only need to share it once, and then you'll be logged into the site. But it allows for easier messages to be sent, and they are already developed messages to be able to promote legislation that you all are working on. Again, we can work on this at the city level, state level, and the federal level. There are also opportunities to share your story, which we will talk more about next. We will talk more about the share your story element next month. And then there is also an opportunity to log interactions with legislators. We will hear more about all of the advocacy that is going on across the country right now. But if any of you are already meeting with legislators, if you can remember to share those interactions with us, it helps us to track and understand where you all are at and how the trauma-informed movement is building and growing. It's a really nice interactive tool to support us knowing where folks are taking action and how we may be able to be helpful. And so all of that is available on these sites. And this is, I will admit, a little bit uncomfortable to say, but we are a nonprofit organization, and so I need to get better at saying it. We are launching our first ever donation campaign that we're calling Amplify 2025. We have made these investments to be able to enhance our CRM system, to be able to better track and manage our relationships with all of you as advocates, as well as the advocacy software to better be able to mobilize around trauma-informed policies and practices at all levels. But we are launching this Amplify 2025 campaign to try to raise at least $25,000 to be able to sustain this work for the trauma-informed movement moving forward. And we just wanted to share that. There are going to be emails coming out about that. We're not going to email you all too much. For those of you who are getting texts and emails throughout campaign season, you don't have to worry. We're not going to be on your phone or in your email every single day, but we will be sharing some more information with you all as this goes on. One thing that we want to share that is very important to us is that whether you can donate or not does not impact whether or not you can use these tools or not. It is very important to us that this is not about pay for play. This is about supporting the entire trauma-informed movement and promoting trauma-informed policies and practices broadly. But if you are able to donate, whether big or small, it's an awesome way to be able to help us continue to make these resources available. And anything that we raise over our fundraising goal will support the ongoing growth of not just CTIPP, but the trauma-informed movement as a whole. And so we will be sharing more about quorum as time moves on. Again, I think that Laura shared some information in the chat that if you all are already working on trauma-informed legislation, please feel free to submit a campaign request to us. And we really do look forward to being able to build these campaigns with you all and support what you're doing at the local, state, and federal levels, in addition to the bills that we are sharing. If you have any questions about anything that I shared, happy to take questions during this call, but also don't hesitate to reach out if it's about donations and you want to learn more about, where the money would go or how we do that. If you have any questions about the campaigns themselves, please don't hesitate to reach out to me at jesse@ctipp.org, and we will be happy to talk with you all there. And so I hope that made sense. We will continue to figure out how to make that make as much sense as possible, but we want for that to be as useful as possible. And I see Laura just shared a bunch of links in the chat. So thank you for that, Laura. And so the last thing that I will say, and then I know that I started off this call by being like, we're going to build a network. And then I've been talking for the last 15 minutes since saying that. But the last thing that I will share very, very quickly is the federal update that we will always provide to folks from our lens of what we're looking at from CTIPP. Obviously, next Monday is Inauguration Day, and the new administration will take seat and power in the White House. Congress, the 119th Congress, has officially gotten started. Committee assignments have been formalized, and so those can be found for both the House and the Senate. We are seeing legislation beginning to be introduced. The legislation that CTIPP most proactively promotes, which is, at least from last Congress, the Community Mental Wellness and Resilience Act and the Rise from Trauma Act, we expect to be introduced hopefully within the next month or two. There's some public comment period that's going on right now, certainly around CMWRA. We will keep you updated on all of that. But as of right now, it feels like Congress is just getting its feet under itself, going through confirmation hearings, that sort of stuff, some legislation, but really getting committees set up. And the new administration has not yet taken seat. And so we will have more information on that as the year continues, in addition to all of the campaign supports that are going on all across the country that you all are leading. Now, for those of you who were on any of the last 4 calls, as we did that trauma-informed advocacy training, which we are going to turn into, if you weren't able to make that but want to, we're working to turn what was 4 calls into a 1, 3, or 4 hour session for those of you who want to be able to either practice those skills in terms of creating a pitch and promoting trauma-informed policy and approaches to advocacy. We will come out with more of that information. But for any of you who are on those calls, you know that I'm working on legislation at the local level in Philadelphia. I will not share that first because, again, this is where we want for it to be everybody has an opportunity to share about what they are working on and for there to be a supportive network. We are trying something new with this call. Want to acknowledge that it might be a little bit messy. We are happy to open up breakout rooms for smaller conversations to take place if we feel that that is appropriate at any point during our time here together, but want to open it up to anybody here who wants to share about what they are advocating for. And if you have already taken on some of that process, what that process is looking like so far, and create that collective support. And so I will pause. And if anybody wants to share what y'all are working on, we can't wait to hear about it. Yeah, Inga, please. Thank you.
What we're fighting for right now is a little bit different from the legislative end of it. We're actually fighting for implementation of legislation. So the piece of legislation that was passed about 4 years ago was to create a governor's commission on trauma-informed care. Passed the governor. It was put together. It was created. and we worked for about a year and a half. We got a note in April of 23 saying the meeting that will be held on April 15th will no longer be held. We are being moved to another state department. So, and we've heard nothing since April of 23. So, what I'm working on now is working with politicians that I know and trying to find out why exactly we haven't heard anything, what's going on. And this is legislation. How do we get by with missing 2 years of report? Somebody's not paying attention. So that's what we're fighting. It's like, you got to maintain it. Once you put it in place, you got to maintain it. And there's not an end point. It's a process.
And I'm going to butt in here a little bit. I was an auditor for CHDP for the last 12 years. And we were bringing about change for not only the depression screening for maternal health, we were doing the ACEs, developmental screenings were not being done. And we were in a transition of moving from mostly Medi-Cal children, that they were all being transitioned onto managed care plans. So the one thing that would actually get the providers to change, because you can implement all the laws you want, if you are not auditing for it, or there isn't a financial incentive behind it, you are never going to create the change. The doctors will never change. We didn't have the enforcement ability to actually force it because all the kids had moved out of Medi-Cal and then they were on managed care. So look at the future, make sure that you're planning for that and how the financials are going. So not only write it into the legislation, but have it backed up with the financial plan of how are they going to get paid. We had to pay I'm assuming that everybody has FQHCs. Those do not get paid separately, but you need to know how an FQHC is paid. They are not paid like a regular Medi-Cal visit where it's either fee for service or a managed care plan. That FQHCs get paid on a different scale, but they thought they got paid for the visit. What they don't understand is that they're audited every year and they take like 30 charts and they add up everything they did. So if they're not documenting that they did it and they're actually doing it, they add up the price of the 30 charts, they add up the total divided by 30, and that is the base payment of how they're going to get paid. So they're thinking that they're not going to get paid, but really just the way that they're audited is completely different. But unless they know that, they're pushing back saying we're not going to implement anything new, we're not going to do this. But the key to this is you need to make sure that they're in the managed care's audit tools. Even when we were making the developmental screening recommendation, they're pushing back on us saying that that's not a requirement for our providers. We had to go into their manuals and say, yes, it is. They had no idea, but their audit tools did not audit for that specific thing. And therefore, there was nothing you could do about it to create the change that you were looking for.
Yeah, I hear what you're saying, but our charge in the legislation was to create trauma-informed state departments.
Yeah.
So any department that works with children, families, or older people, that's how the legislation is stated, has to become trauma-informed. According to the legislation. So it's a little different, and there's no money attached. That's the whole thing. There's no money attached to this legislation.
Inga, what state are you in?
Maryland. Got
you. Right on. I think one of the things that I just want to uplift, I really want to just uplift how important it is that you're sharing. You know, it's not just about passing new policy, but it's also there's opportunity for advocacy around how we are enforcing policy once it gets passed. And I think that that's a really wonderful piece to lift up for folks.
And you have to have the trainings available
as they're looking for, you know, how we are actually enforcing policy, right? Because words on a piece of paper themselves don't create trauma-informed like practices, right? There's got to be kind of the whole life of policy work that goes long beyond just passage, right, to implementation and then to recreation. And so really appreciate you uplifting that. And there are some other states, if it's helpful, to that might be able to look at. I know Heal PA's plan may be helpful, and they've created a plan. The Interagency Task Force on Trauma-Informed Care at the federal level took a long time to get funded to start moving. That as we move forward, there are some examples that may be able to provide support as you continue to move forward on making sure that this priority of making Maryland a trauma-informed state really hits the ground in the ways that the legislation intended for it to.
Yeah, the sad thing about this, I won't belabor this too much, but the sad thing about this situation is our governor changed hands in 22. And so, so he had as his platform trauma-informed care. But he is the one who is not making movements to push us forward, and in fact is being secret and untransparent about it. And we haven't been reappointed since the new administration in 22. It's going to take some work and some politics.
We look forward to hearing about the progress, and thank you again for sharing. Jenny, I see your hand up.
Hi. Yeah, so I am fairly new to the policy advocacy side of things and actually implementing all of that. So one of the things that I am assigned to do now is I've just joined the Treatment Not Jails Coalition, where we are advocating for, and this is similar to what Inga's issue is the actual implementation. It's or rather it's a amendment to the bill to include changes to treatment court processes to ensure that they are utilizing trauma-informed care, evidence-based practices, and that it's a lot more uniform across the board, to kind of eliminate a lot of that objective kind of judgment when it comes to, you know, who is deciding if this individual can be evaluated for treatment courts versus if they're going to be charged with, you know, the crime and things like that. So, like I said, I'm fairly new to all of this, but one of the things that Susan said that resonated with me is that auditing piece. And I don't know if that is just something that is kind of known in this world. But that is something that I think that I'm going to be bringing back to our coalition to kind of figure out. So I don't know if that's coherent at all, but that's where we're at right now. We are going to Albany on Tuesday for an advocacy day. So that's where we're at.
Right on. We heard from someone from upstate New York earlier. Make sure we bundle up when we go to Albany, and most places throughout this country right now feel very cold. As I'm only in DC, so I can't say everywhere around the country, but I've heard that it's cold in many places. So if it's cold, bundle up. One thing that comes to mind, Jenny, as you share that, and Inga, like, not trying to put anybody on the spot, but one thing that we can do here is, are there other folks who are working on implementation side right now in their advocacy? Because what we can do right now is open up a breakout room for folks to be able to join who are interested in talking about advocating around implementation specifically, if that would be helpful. And then in the main room, we can talk about other pieces. If that would be of interest, let me know, and I can make breakout rooms optional, and then y'all can choose breakout room 1 if that would be of interest to share how we move forward on implementation. And then we can come back together. I can close the breakout rooms around 3. So y'all would have a half hour to discuss that. I'd love something like that in general, but I am willing to listen also. That's great. Just let me know. Happy to do that if that can be helpful for folks. But Jenny, really appreciate you sharing and glad that Susan's comments were helpful to you. Here, I will go ahead and do that in case that can be helpful, where right now I'm creating 3 breakout rooms that shouldn't put anybody in there. I'm going to close them just so that way I take off the timer on it. So there should be breakout rooms now open. And if anybody wants to join a conversation just around implementation, you can join breakout room 1. And if other folks join there, that's great. If not, that's okay. But what are other advocacy that are going on around the country? One of the really exciting parts about this call is that we just get to hear about all the wonderful advocacy work that's taking place all across the country, which itself is very, very exciting. Bill, I think I saw your hand.
Yeah, I don't know if this exactly qualifies for advocacy, but it's a post announcement that I think is very relevant to an opportunity. So the CMS Innovation Center just approved a $255 million initiative around transforming maternal health. And it's going to be 10 years, just started in January. They announced 15 states, and their Medicaid agencies will be taking the lead. Where I think there's a big opportunity, and what we're trying to mobilize support for is that as they're thinking about maternal and child health, a lot of the things they have in their documents are about getting early prenatal care and low birth weight babies and maternal mortality rates and infant mortality rates and even maternal depression. What is, I think, under the missed opportunity is to really focus on that 4th trimester, that neurodevelopment, the early relational health, which is so profoundly important in the trajectory of an infant's life and their development of self-regulation and executive function and those vital things. So since they just were announced, they essentially have the first couple years of planning over this 10-year period. I think to the extent that we can engage with those state Medicaid agencies and anyone they have engaged in that, or the national TA providers, and support, well, the term we use is neuro-nurturing. I think it can really help build the resilience of the infants rather than waiting and screening and diagnosing and trying to be reactive. So that's I guess, a type of advocacy for something that has passed, has been funded, but now we want to make the most of it.
That's absolutely going to count as advocacy, Bill. Really appreciate you bringing that up. Yeah, that gets into the life cycle of the advocacy work that we do. It's never done. Even when that money gets spent, we want to talk about how it was spent well, so that way more money can be unleashed moving forward, right? And so, again, these are really wonderful examples of the many ways that we can be advocating. Really appreciate you sharing that.
And that was one of the things we talked about introducing neuro-nurturing, the importance of neuro-nurturing, how to create neuro-nurturing ecosystems, and some of the secret sauce ingredients that are very inexpensive that can become integrated into the parenting of a lot of the lower income, more marginalized moms and the fathers, to have a big impact, even if we can't address all the other challenges they're facing. There's interventions that we think have a tremendous potential. So I'm going to put the link to the recording of last Friday's webinar in the chat again for those of you who didn't get to see it.
Appreciate that, Bill. Want to highlight also, that reminds me of the work around the decade of the child that Dr. Denny Fishbein is working on out of the National Prevention Science Coalition to Improve Lives. But I know that there's a lot of energy and advocacy going on around building those healthy childhood, healthy futures. I see one person is in room one in case anybody else wanted to discuss implementation, but didn't want to be the first person in the room. So just wanted to highlight that in case anybody else wanted to hop over. And also Jaje's wonderful suggestion that folks can exchange emails. And she was brave enough, thank you, for putting your email in the chat. If anybody else wants to share their information, please use the chat box as well. Again, we are trying to figure out the best ways to build a strong network, and to stay in touch with folks is a huge way to be able to do that. So just wanted to highlight those two things. Wow, there's a lot of great advocacy going on. I'm feeling more and more inspired. I'm excited to share mine, but anybody else want to share what they've been working on or are planning to work on, even if, again, it's okay. It's January 15th. So if we haven't taken action yet this year, that is very, very okay. We are just entering week 3 of the new year. So there's 50 weeks to go. We are all good on that.
Greetings, beautiful beings. I would love to share if that's okay.
Yes, please.
I hope you all are drinking water, taking care of yourself. So my name is Fatima, Fatima Man. I run a business called Love and Healing Work, where I use my law degree to help businesses and organizations, as well as the government, create practices that are, I like to call healing centered instead of trauma informed. So how are we focused on the fact that everybody has experienced trauma, and how are you creating hiring practices? How are you updating your policies and procedures to reflect that people need space to regulate their nervous systems and do these things? And so one of the things that we're working on this year is actually providing more space for the advocates. A lot of us are doing really great work, but without the space to decompress our own vicarious trauma from doing great work. So how are the frontliners, the frontline advocates, how are they being taken care of? Who are creating experiences for them? So there's a race and transformation healing circles. The National Day of Race and Healing is on the 21st. And so we're doing like healing circles. I help really those on the front lines regulate and take care of themselves, because the people that are helping the people need space to be human too. And a lot of times that's where the burnout happens, is that organizations aren't implementing space for the people to be human and to honor what they need from a policy perspective. Not just like, oh, we're going to have these experiences. Yes, and how are you documenting that people want certain ways to be engaged with? I call them invitations of engagement. So how do you create invitations of engagement where you're talking about conflict resolution, mediation practices, so that the work can continue? Because a lot of us are doing really great work, and then we hit this conflict part with some people that are humaning, and then the work stops. Or, you know, life happens, right? A lot of us are experiencing collective grief. A lot of us, the world is freezing, the world is on fire, there's violent acts happening, and people don't really have the time to process because they're doing the work. So the thing that I've been working on is creating virtual experiences for us to process our grief once a month, so that through storytelling and meditation, these are really for people who are doing the work but have no place to honor that they're grieving too. And then making sure that those that are on frontline advocates just have space to say, okay, like I've been working really hard on this policy. How do I work on this policy and not lose my mind? How do I make sure that I'm doing this work and the implementation of it, right? Because a lot of times we create these great policies, we forget about all the humans that are going to be impacted by the implementation of the policy, all the humans, everybody, not just the people on the side that we're working to make sure they have access to these amazing benefits, but somebody has to administer those things. Are we making sure that the policies that we're advocating for think about them too? Or are we just looking at the people in need? Because the people in need are also some of the people who are in the systems that are doing this work. So really just creating spaces for people to do great work without harming themselves or others is really the work, but doing it through policy within organizations, within cities, within counties, and then Texas government. So working with the Texas legislature, they're in session this year, it's an odd season, and looking to see how are they moving some of their grant funding to the public health aspect of the, like, especially because of the hurricanes that happen in Houston and that area. They're really looking to see how are they embracing trauma-informed care, but my last caveat about trauma-informed care is it culturally mindful? Is it like based off of the indigenous, the people who live off the land, the people who just don't really subscribe to some of the things that we're saying? A lot of the trauma-informed care is really whitewashed, and from a colonized perspective, it isn't really based off of the people in underserved communities that need and a specific type of hand-holding, if you will, because the cultural norms are different. So really looking at how do we help people create trauma-informed care that is also culturally mindful, because those two things are different. And sometimes we get caught up in the trauma that we forget that everybody doesn't deal with trauma the same way, and everybody doesn't need the same care when we're talking about that. Thank you all for listening.
Appreciate all of that, Fatima. Thank you so much for all you're doing. And that looks like it inspired a hand raise from the Neutral Ground Collective.
Yes. Hey, doing similar work, Fatima. I'm in New Orleans, Louisiana. I'm the founder and director of Neutral Ground Collective. I started this, we officially started in 2019, but this is from my experience after Katrina. We address collective trauma. So I am a trauma specialist, certified trauma specialist, EMDR, IFS, somatic experiencing, and TCTSY. I'm also a polyvagal informed art therapist. So we use creative art therapies and somatic based interventions, community model approach, leveraging the strengths and resources of the community itself. So we teach back and they then teach back to their community. I'm also Louisiana Creole and Indigenous, so I'm working with all the Indigenous communities on the coast. And like I said before, we're disaster specialists as well, mental health specialists. So we are doing some national work right now, providing vicarious trauma and secondary support. We're working with firefighters right now in LA, and just among other organizations. We're not the only ones that are providing some trauma sensitive support for them. And so we do, the important thing here, the advocacy component here is that we know that there's a possibility for collective post-traumatic growth. And, the individual does need, is affected, but when we start with community first, and then we can branch out and help. We have a collective of therapists if someone requires some extra individual care. But we know, like through co-regulation of the nervous system, some people can get unstuck. So that's sort of like where we are. Advocacy right now that we are doing, I don't know if y'all understand, Louisiana law is Napoleonic code. So each parish has a little own power, and I'm in New Orleans, which is Orleans Parish. And I don't know if you're aware of the politics, but we have a governor that's, not good. And so right now we're trying to go in some of the collective members with the city council and just encouraging trauma sensitive. We don't say trauma informed, we say trauma sensitive language, practices, choice making, specifically the homeless population. The governor wants to actually put them in a bus and move them out of the state for the Super Bowl. So right now, that's what we are kind of addressing, that, we don't do that. And two, using trauma sensitive language when addressing people who are unhoused. So that's what we're doing right now. Baby steps.
I have a 2-year-old niece. Those steps sound bigger than a baby's. That's really impressive what you got going on, and I really appreciate you sharing, all of that. And yeah, just want to uplift, and I won't be able to find it, but I think 2 years ago, around some of the forced institutionalization policies that were coming out around unhoused populations, we put out a blog post. At that time, it was to try and support, I think that it was really LA or maybe California at large, and New York City were some of the blue areas that were leading on that kind of forced institutionalization practice. Is certainly not trauma informed or trauma sensitive. That is trauma inducing type of policy. And so appreciate the work you're doing on all that. And if that can be a helpful resource, just wanted to name that for you. This is all really, really wonderful. And we've got folks, I mean, there's stuff going on all over the country. It's incredible to hear. And I see chat box activity, and still we've got that one person waiting to talk about implementation in room 1, if anybody's hoping to join them. But are there what other advocacy is going on? I've got another question to a lot of the comments that came up, because we do want to create a space for folks to process, want to talk about how we're staying well and how we are promoting well-being for ourselves, because we are all worthy of the changes that we are trying to create in the world, but want to hold off in case there's anybody else who wants to share about what advocacy they are promoting, what movements they're making right now around trauma-informed or trauma-sensitive or healing-centered policies practices.
I could go.
Yeah, please.
My name is Dion Blackman-Moeller, and I've been a part of y'all's group since 2017. So I do recall some of those very early on pre-COVID sessions that you were discussing, and I don't have as much value to add in this moment other than to just share with you all what I am doing. So I'm currently a doctoral student at San Francisco State University. My dissertation is on trauma-informed practices in education settings for adult learners. I specialize in working with youth that are 18 to 26 at my place of employment, which is a nonprofit education-based training center. And so we help folks get into either a career change or launch careers based on the fact that we have a non-paid, tuition-free curriculum they can go through, become certified nursing assistants or medical assistants or office administrators. So my job here is twofold. It's one, to support the students who are in need. A lot of our students have a bunch of barriers to their employment. They have newly divorced, going back to work after, raising kids, survivors of domestic violence, transitional age foster youth, that kind of thing. So I am our resident trauma specialist, and I've started with where I am. Next week, I will be at my company for 8 years, and I have done some things that have shaped our disciplinary practices to make them more trauma aware, right? And then I also have 2 segments where I teach the staff as well, kind of a trainer type of thing, where I support our staff who are the direct service personnel. And so we have every other month we have a session where there is a mental health component that helps to not only support those, like Ms. Fatima was saying, when you have those who are on the ground who are doing the work and them not having a space of their own to kind of hold on to some of that and to process that tertiary or vicarious trauma that they're enduring. Especially since a lot of us are having that long COVID experience and fatigue and some of the new challenges that are coming up as a result of what we've been through for the past 5 years and what's coming. So yeah, I don't have anything that is yet ready for, say, the national or state level, but I am starting with the organization that I'm in and doing the best that I can to support the students and the staff that I have access to in this immediate, and really working diligently to get some of our policies that needed to be evaluated and looked at. So between that and my dissertation, I love being able to commune with you all and learn from you all and hear about, like, in my opinion, like what would be next, right? Like for me, a lot of the work that you all are doing is where I'm trying to get to next. So my involvement has been more on my local level, but I'm really excited to be with so many people who have experience with expanding beyond that and getting things to the state level or national level. It's really exciting for me to be a part of and to hear and learn with you guys. And I'm just really happy that that I found my people, right? It's not exactly an exciting topic when, your life's work is surrounding trauma and the ramifications of it and the prevention of it and the reduction of it and that kind of thing. So there's not a whole lot of spaces where I can I guess, speak freely and about the frustrations that come along with it and the challenges and how all of that is playing out. So I just really appreciate every single one of you guys. And even on the months where I'm not able to attend in person because I'm either in the classroom or with staff, I watch the recordings on YouTube. So I just want to say, keep up the great work. And I'm here even when I'm not here. And I just really appreciate you all. It's very inspiring.
I just pulled a Dan where I was speaking to myself for 30 seconds while muted, but wanted to say thank you so much for sharing. That is absolutely advocacy. We talk about organizational advocacy and doing stuff at the programmatic level. That's necessary too, right? Trauma-informed policies and practice, and they work together. And just want to say that you're inspiring to us as well. And thank you so much for sharing all that you're doing with your dissertation and the work and how those are weaving together. Really excited to see and hear how that continues. And would also love to hear about what the 2017 CAN calls were like. I want to make sure that we do service to the original model because it was so good when Dan would run those, and it was such good conversation. So that's really exciting to hear as well. Really appreciate that and all you're doing. Incredibly valuable. I see something in the chat and with some thumbs up. Are there other places of advocacy? Phil, you're off mute if you want to share.
Oh, I just put something in the chat. We're using lots of different trauma responsive, trauma informed. I think having a discussion about which are there, what do they mean? What have been some of the negative repercussions of using them? I think one of the, as we're moving forward, trying to come up with a terminology that can be more consistently used, because sometimes people talk past each other or argue each other unnecessarily based on sort of a nuance of the term versus being 95% in agreement. But I think people also talked about culturally appropriate and other things. And so I think there's some important aspects of a second sentence for some of these things. And I think this might be a good setting to, people have obviously been using those terms, have feelings about the benefits or the detriments of some of them. And I think, again, if we can have a discussion about that in a future meeting and maybe sort of understand how sometimes when we say something, it's misunderstood by other people or even seen as negative by other people because we didn't really understand the context that they view that term in.
That's a great idea, Phil. Yeah, we'll share more as we continue to organize these sort of broad coalition brainstorm network type topics. It looks like that's a really good idea. And yes, Jenny, I am sorry you sent that to me directly. I should have shared community agreements at the beginning of this call. And so that will also be something that we start to do from the beginning of calls to establish community agreements amongst the group as we share out. But Phil, I think that that's a wonderful topic that would be really good to have kind of a brainstorming conversation about. And we'll take note of that and make sure to follow up with this group on that topic. And the thumbs up show that, you're not the only person who's thinking about that. That'll be real valuable. For moving on, and then I'm happy to share some updates on the Love Act, but are there any other areas of advocacy that folks are engaged with that they want to share with the group? Bill, I see your hand again.
Yeah,
Hello.
so in the state of Minnesota, there's a grant for early childhood development that the health department or human services has just announced. And as is often the case, there's a kind of a fragmentation of a big chunk of money broken into a whole bunch of $75,000 a year grants for 3 years, and everyone's competing on them. We're working and building out a larger framework, what Michael Quinn Patton calls a theory of transformation in the form of a strategy map, and encouraging the applicants to look at where do they fit in this larger strategy and emphasize how they're aligning with other efforts and building on other funding sources rather than just trying to package their own little isolated, siloed intervention for these grants. And we're trying to talk, we haven't done it yet, but we're trying to get to the people at the state level and encourage them to be focusing on more system thinking and reinforcing the many different funding streams and nonprofits in a more aligned way, rather than continuing the processes that has everyone competing against each other and working in isolated interventions.
Appreciate you sharing that, Bill. It's another great advocacy area that you're involved in. Inga.
Hi again. I live in Frederick County, Maryland, which is partially rural and partially suburban urban. And we have about 300,000 people in Frederick County. And at the beginning of COVID, I saw that there was going to be absolutely no governmental infrastructure created for the behavioral, to address the behavioral health needs that we knew were going to come up during COVID. And now they've come true, of course. And so I was asking, I asked governmental agencies at the state and the local level, they didn't have anything planned. So I decided to create a group called Trauma Responsive Frederick. And it's a social change group, no direct services. We do advocacy, education, and collaboration in order to accomplish our goals. And we're having a hard time finding funding. That's the advocacy that we're kind of doing now. So I just wanted to tell you that we're a community. We're trying to create a trauma responsive community, and we've gotten a lot of support. We just need the funding to be able to do some of what our dreams are. Thank you.
So
Thank you, Inga.
yeah, Inga, we had about, I think, 10 or 12 people from Frederick. It was a lot. They're from Maryland that were on our webinar on Friday. I don't know if you know Rachel Mandel, but we're starting to get some conversations of going after some national grants to make you guys a model. So let's connect and chat.
Who's speaking?
This is Bill Barberg.
I'm sorry. Okay. Yes, absolutely. Let's chat. Yeah, Rachel is our consultant on the project.
Yep. Yeah, she reached out to me and I think got the word out to some of your people in Frederick. So we'd love to pursue that with you.
Great.
Feel free to-
I'll put my email in the chat.
Thank you.
Sounds great.
And just a comment on funding, I think one of the things that we look at is finding the local communities that are doing really good things and work with them to pursue. We have a whole long list of national funders working on early childhood and trauma related things, and help them show how your local example is building tools that can be freely shared for any other community. And that way, national funders would be more motivated to put money into your community because you're doing things that will benefit all the other communities they want to support. And it becomes very economical then.
Appreciate you sharing that, Bill. And glad that y'all will be able to connect and make Frederick such a community. And Inga, it's great to hear how you're working at the state and the local level. I think that coordination alignment across levels is also really, really powerful. Jill, I see your hand.
Yeah, hi everyone. Just wanted to throw in a little bit of a different approach that we're doing here in Nashville. Very small with the Nashville or Greater Nashville area, but it's a primary prevention approach to trauma, where we're looking at promoting positive childhood experience, specifically supporting relational health throughout a child's life, but of course, most importantly, in those first 3 to 5 years, and build that as a buffer to adversity and trauma in a child's life. So, from a policy perspective, what our work group of a larger organization is trying to do is engage the healthcare community in this work. I'm a pediatrician, and really, as that being a place where primary prevention can flourish. And so, to that end, it's a growing an awareness for relational health and how can we incorporate supporting that or supporting nurturing relationships during our well child visits. If we can build that awareness, build it as a sense of we pediatricians have, or others who care for children, a unique opportunity, a power, let's say, to really do this. And it's not one more thing that they have to do. So sort of a bit of a different, the incentive is an internal incentive to healthcare providers of doing something that really is fulfilling for them and the family. And then being able to hopefully mobilize them into speaking up for policies that support relational health, such as quality childcare, paid maternal leave. So we're not really creating new policy, but know that those are policies that have been designated by Prenatal 3 Policy Impact Center as extremely important. And we know that the AAP has lobbyists, and our state level Tennessee AAP has one as well. This is more of a whole package approach, and really trying to make help pediatricians or other healthcare providers tell the story to their legislators of what this would mean for children ultimately thriving, and then of course our community thriving and all the economic factors with that, or whatever not. So really trying to piece together that story. But we're still on that first step of engaging the healthcare community with all these other wonderful people like Melissa McGee on the call. So I just wanted to share sort of something different that's going on here. And Bill, I really want to connect with you as well.
Appreciate you sharing all that, Jill. Yeah, I think that Bill, did you share your email in the chat? But
I did, but I will again.
yeah, love our friends in Tennessee. And Melissa just said lots of exciting things happening here in Tennessee. So it's great to hear how you're advocating and how yeah, you're using your area of expertise as a doctor to be able to use a platform to, create a movement amongst healthcare professionals. I mean, that's really inspiring and a really great way to build coalition to drive lasting, sustainable change. It's a beautiful example for that. I know it's after 3. I mean, it's amazing how long. We'll just keep this one going for a while. Just wanted to share, and then if anybody else wants to share their own advocacy, please. The updates on the LOVE Act very quickly, the Lowering Overdose and Violence Epidemics Act, which is the bill that I wrote and am trying to pass in Philadelphia, very much derived from learnings from the Healing Cities Act in Baltimore around coordination and alignment within city government and agencies is it needed to wait until the end of 2024. If anybody was paying attention to Philadelphia politics, which unless you're from Philadelphia, I don't overly expect that. City council was overwhelmed, I will say, with the potential for the 76ers, which is our basketball team, their arena to move into Center City. And that was a 2-year process that was very, very contentious. And especially toward the end of last year, took up a tremendous amount of oxygen in the room in city council. I share that as a lesson learned in local government where, and government at any level, that those sort of like the amount of the bill was about 1/3 of the city's entire budget on any year, or the potential economic ramifications. That is very difficult to override when we're advocating sometimes. And so I had to learn patience, and I'm still working on that. But the 76ers arena, the culmination of that story is actually that after the bill passed, they wound up moving somewhere else, which is overall a good thing. It would have, in my opinion, it would have displaced the Chinatown community pretty heavily, and that was where a lot of the pushback was coming from. And now they're building a new arena in South Philly. But now that that is no longer on City Council's docket as heavily, there are a couple offices that are interested in different elements of the Love Act. One seems to be very interested in the coordination and alignment within government services within the city, specifically health department related services. And then there's another that is more interested perhaps in building those cross-sector community-led coalitions and the grants to support neighborhood level action and neighborhood driven action where it's really community led, not just community based, which are the two main components of the Love Act. And so I've got meetings in City Hall with a couple offices next week, as well as with folks at the administrative level. There's a chance that the managing director's office would be really good to lead the interagency coordination. And so trying to meet with folks to figure out where that coordination within the government would actually sit within. Because if we just bring together a bunch of agencies without someone leading it, it can get messy and kind of lose its momentum and steam pretty quickly unless someone is directed to really organize that. And so that's where the Love Act is, and hope to have good news on that next month when we are together. In addition to a lot of the federal activity that hopefully takes off. And then at the state level, much to what Inga was saying earlier, in Pennsylvania, there's an initiative called Heal PA that is the state's trauma-informed care initiative. It is actually moving into a state agency. It was a little bit more of an orphaned initiative. I don't think that that's the actual word for it. But it is now moving into a state agency, and just the time to position it within a state agency is taking some time. And so that's kind of on a little bit of a pause there, as some updates on the local and state level as well. Again, that's out of my other nonprofit, the Change Campaign, not what CTIPP's driving. CTIPP's creating space for the national movement that we are all involved in. Are there any other pieces of advocacy that folks are involved in that they want to share about? And then my other question, and if folks are getting tired, I mean, we do not need to just, I don't want to prolong a call. Time back in all of our days is always so valuable. But the other question that I had, anticipated to ask is, as we talk about all this work, much like Fatima was talking about earlier, it can take it out of us, right? It takes a lot for us to continue to move this work forward, and certainly can, depending on how many barriers we run up into throughout the process. And so if anybody's got any insights on how they're taking care of themselves throughout this process of advocacy, I know that that's a little bit personal. Nobody should feel pressured to share, but also wanted to, as we create this support network, for folks to process and for us to continue to see how we are moving forward. If anybody had any insights that they wanted to share on, ways that we can be mindful and take care of ourselves throughout this process, as from development of policy or practice to passing a bill to implementation and the full cycle. It takes a long time. So we got to make sure that, we're taking care of ourselves so that we can be in it for the long haul as well. And just wanted to see if anybody had any thoughts on that they wanted to share. Go for it, Bill.
All right, this is maybe a little not exactly what you were asking for, but in our work in Canada to transform the family justice system, we knew there was a lot of work that needed to be done under the water of the iceberg, the lower part of the waters of system change, around mental models and training and whatnot. And one of the things that was a big victory is because of the success we've had at transformation level work, the Alberta Law Foundation gave a large grant to establish a Center for Transformation at the University of Calgary that is a joint program between the law school and the School of Social Work. And part of it is to help train up a generation of people who understand not just how to work in their functional role, but how to bring about system change and to build on the work and the how do you evaluate, how do you manage large scale system change. And when you look at changing systems, that policy is one part of it, but there's a lot of elements of systems that aren't necessarily controlled by policy, and changing them has often been seen as very, very difficult. And it is difficult, but techniques are emerging, and the establishment of this Center for Transformation at the University of Calgary, I think, is an important step in seeing what transformation practices can look like, in addition to advocacy and some of the other things.
Appreciate that, and congrats.
Thanks.
That's tremendous. Yeah. Are there other thoughts on how we take care of ourselves, or any related topic too?
Hey,
I will-
Jesse, I'll jump in for a
Oh,
moment.
there.
Hi everyone. This is Maren Scalone. I apologize for my camera being off. I'm a little under the weather, so I'm not camera ready, but input ready maybe. I'm over here in Richmond, Virginia, with the Department of Behavioral Health. And this one it's definitely more of personal how I take care of myself, but I think it feels applicable. Sometimes I find it really regenerative to talk about trauma just from a very casual and sort of basic, like intellectual level with someone who is completely not in the field at all and can totally step away. And just from a really kind of psychoeducational, like totally basic value, I find that kind of reawakens my own sort of that first spark, like the honeymoon phase of it, if you will, when I get really bogged down with the nuance that we all work in every day, of just sort of talking about that, what felt like kind of magic to me when I first began to understand trauma science, of here is how what we go through impacts us day to day, and just being able to have those really basic stripped down conversations with someone outside of the field, outside of that scope, sometimes really helps me kind of remember my why when I feel very wrapped into bureaucracy or any sort of like higher level swamp.
We really appreciate you sharing that, Maren, and hope you feel better soon. But that's a really great idea. I don't know if I've ever tried that, and I love how you describe that honeymoon phase of kind of what brought us into the work. That's really, really great. Appreciate you sharing. Any other practices? I will share that Jaji, please.
Okay. Oh, sorry, Jesse, I was muted. So, talking about self-care and what we do, and Maren talked about, looking at what we do or the purpose of our why. One of the agencies that I worked at with many of my clients, we did a program, and they, at the end of the program, would write goodbye letters to the people in the program. They also sometimes would write letters to us as the therapists. And so sometimes reevaluating my why, especially now with what I'm working on and stuff, it's mind-boggling, and you just feel like, gosh, I'm not good enough, I can't do this, or you worry about imposter syndrome. So one of the things I like to do is sometimes I go through and I reread some of the letters or some of the cards that I've gotten from folks, because it does tell you your why. When you read, either you've helped them change their behaviors, help them change their outlook. And so you touch more people and you do more than you think you do. But sometimes it's nice to be not so much accolades and praise and all this kind of stuff, but getting you back into the place that, hey, you do know what you're doing and you are capable of doing what you're doing, But yeah, sometimes we tend to question ourselves more than we should. But it is nice to be affirmed. I wouldn't say, again, not praising and all that, but affirm, and be okay with affirming yourself that you know what you're doing. I think we tend to not do that. And I think that's very important.
Appreciate
That's my
that.
2 cents.
Yeah, I think it can be really hard when it feels like so much of the rest of the world questions us sometimes. I can
Oh,
see
yeah.
why that affirmation, being affirmed in, and that self-affirmation when we can, and is so valuable. Really appreciate that as well.
Yeah.
Jesse, I can add one.
Yeah, please.
So Laura with CTIPP, your comment about the long haul nature of what we do, right, really struck with me because that can really sort of drag me down some days, not feeling like, gosh, like we needed all this yesterday, right? So I found just recently it's been really helpful to go down just different rabbit holes on the latest science and research and really cool techniques and things that are happening. My latest one is all about ibogaine and its use with opioids and sort of the whole backstory of all the efforts going on in Kentucky that have now seemed to switch to Texas. And I just find that going down these little rabbit holes, it's like it reminds you, yeah, like there's big stuff happening. There is progress happening, and there's really exciting things happening now and just on the horizon. And so that has helped reinvigorate my spirit in this work.
Thanks, Laura. Your curiosity is appreciated by the team and by the whole network. I mean, that's a wonderful practice. I will share that for me, it has been a daily morning prayer is like the first thing I do when I wake up now. And then also exercise, which April I see I'm trying to read while speaking, which I cannot do. I mean, my brain just doesn't work that way. But that regular exercise practice and taking care of myself when we're able to is really, really important. And that's become part of a daily practice. April, I'm going to go ahead and read your silently. I don't want to read for you, but if anybody else wants to share their practice, whether in the chat or aloud, please feel free.
I'll speak. I I work at a mental health agency and I work in compliance, so a lot of times I just see all the bad stuff. So it can get a little heavy. One of the things I like to do, obviously, like reading or like taking a bath or like, playing with your dog, whatever. But I have found recently that if I can try to hit all 5 of my senses at the same time, it almost does a reset for me. So, like, I'll, be reading, but I'll also make sure that I put music on or have like a salty or a sweet snack, some sort of, like fuzzy blanket or comfy pillow, like something there to, that way I can, fidget with that to try to hit all 5 of my senses. And it just, kind of gives you a quick reset. And I know that, therapists have said for years that, sour candy and that sort of thing, ice cold water can help kind of shock your senses. So I think that that's maybe why it works so well as far as like giving you a reset. And it doesn't take that long, but it's quick.
That's really great, Jamie. I'm going to go give that a shot to get all 5 senses. Also, fuzzy blankets, like we were talking about how it's cold right now. That sounds wonderful and like self-care on multiple levels. And appreciate you sharing. Are there any other thoughts? These are all really great suggestions that I think we can take back and continue to think about even after this call. If anybody's got any, feel free to cut me off, but I just want to say, I know that this call was a little bit different than prior CTIPP CAN calls and appreciate all of the participation. It was a wealth of knowledge and information, right? We're still continuing to try and figure out how to best format these calls to allow for that open communication while also having structure and continuing to move forward and provide the support, both in terms of a network and then the practical logistical support that we can as we continue to move forward in our advocacy. And so if you have any suggestions, as always, please feel free to fill out the CTIPP CAN recommendation form and feedback form. We always look at that, and it always helps us continue to grow moving forward. If you're able to, like I said earlier, please participate or share information about the Amplify 2025 campaign that we're running, so that way we can continue to build upon this work. And if there are any state or local campaigns or federal campaigns that you think that we could help out with the software that we discussed earlier, please feel free to fill out that form. We would love to support you. We would love to partner and continue to support the advocacy that's going on all around the country to promote what we talked about the difference in language, and a lot of times we'll talk about community-led, trauma-informed, prevention-oriented, resilience building, healing-centered, and sustainability-focused work, which is a mouthful. That's where we need to come up with some better language. But all of the different ways that people are approaching this work that is working to promote justice and healthier futures and a sustainable planet and society for all of us, we appreciate that and want to be able to support. And so please don't hesitate to fill out that form. We're going to have the next CTIPP CAN call on the third Wednesday of February, which I had in my mind earlier and have now forgotten. So before I get off, I am pulling up my calendar to see that that is going to be February 19th. It will be this Zoom link at this time, 2 to 3:30 p.m. Eastern Standard Time. We'll have more information about what will be in that call, but we really look forward, thank you, Jajay, to continuing to work together and to build this movement together. We value each and every one of you and wish you all a tremendous amount of love as you continue to move forward in your advocacy, and don't hesitate to reach out if we can be of support. We appreciate you all from the bottom of our hearts, and thanks for spending time with us.